Alrighty, so my name is Jeffrey, and this is the prompt number 6 for the project, the promotion and teaching of HIV for the young woman in South Africa. Let's see if I can click over to the next one. There we go. Okay, so the problem identified is that although the transmission of HIV has been reduced in past decades, there are still quite a few at-risk demographics. So there's a lot of youth that are at risk. There's a lot of popular held beliefs about how HIV is treated or spread, which are not supported by evidence-based practice or any research. So the problem is that we have lots of people who are still contracting HIV positive. There's a lot of people who are HIV positive and they don't know it. And then we have people who are just not educated in all of this. So one of the biggest things about the project like this is assessing the learning needs. So it's really important to go and identify what this population already has known, what they know, what they understand, what they believe, what they don't believe. Because after we go and assess and evaluate where they are right now, we'll be able to go and create a learning plan specifically for their need. That's the main reason why I decided to use the proceed precede model. With this model, I believe it's the first 4 phases of it are basically assessing the demographics, what they believe and what they know, what resources are available, what's the population like, what are the social and economical factors. It's really, really, really important, especially for something like this, this issue, HIV, to go and to have a thorough understanding of where the population stands in order to determine what we can go and do and how we need to go and intervene. There was a study that was performed in 2014, and it was based out of Mozambique, which is in South Africa, and it looked at 26 different families where children were HIV positive, and it examined the caretakers and what their beliefs were, and basically that found that 25% of these parents or guardians, they were totally cool with following medical advice from just their friends or family, people who had no medical experience or background. And additionally, there was another 20%, which were kind of on the fence, where they're like, if their friends told them, like, oh, hey, like, if you want to get rid of HIV, just go and drink this type of water or go have sex with a virgin or whatever the case is. 20% of them were on the fence, where they believed a majority of what people would tell them versus what doctors or nurses would tell them. So understanding that is pretty big, which goes back to the first 4 phases of the proceed precede model, in which we understand that assessing what people believe and where they stand and where they get their information is really important. So the goals and the behavioral objectives for this project. Well, the overall goal is, of course, to educate these young women in South Africa about HIV disease. That includes the treatment of it, how it's spread, the causes, signs, and symptoms, just to go into make sure that correct information is being given. Additionally, providing access to HIV screening as well as resources is the goal. Now, behavioral objectives, these ones are a little bit more precise. We're hoping that those that are willing to participate in this event, in this project, that they are going to be able to verbalize or write down, that they will understand how HIV is contracted, what the symptoms of HIV is, and how it's treated. Now, additionally, the goal would be that 85% of those that participate would be tested for the HIV virus. We understand that there's going to be some pushback and that some people might not want to be treated or tested. Maybe they're afraid of a stigma or that it's still taboo. So the goal is 85%. Now, of those who are tested, of the ones that are HIV positive, or maybe they have a loved one who died of HIV, or maybe they have a loved one who has HIV, the goal is that 85% would go and become actively involved in support groups for the illness. as I spoke about before, the first four phases of the ProSeed Pre-Seed model are basically assessments. The first one is a social assessment, examining what are the cultural views, what is the general population in this demographic, what do they believe, and what are the attitudes associated with HIV? Is it something where people who are HIV are widely accepted and embraced, or are they excommunicated from society? So in order to go and perform this assessment, it'd be using questionnaires, interviewing participants, and it would be anonymously used questionnaires. Looking at the epidemiology assessment, how many people have contracted HIV, what areas are the most at risk, are certain areas or age groups more at risk than others. Now, additionally, this information would be used or will be gathered from using questionnaires, interviewing participants, as well as looking at working with local governments and healthcare workers to go and to find out some of the different demographics and the rates of HIV. The fourth phase, looking at the educational and ecological assessment. Once again, what are the popular beliefs? Where are these people getting their information? What do they believe? Asking them, how is this treated? Ecologically speaking, are there any environmental factors that will either add to this epidemic? That kind of ties into a social assessment of, is there a pressure to get tested, to not get tested? Is there a fear of, if you are HIV positive, will you not be accepted? So using, once again, questionnaires and interviewing participants for this one. The last one is more looking at the administration and policy assessment. So what's currently being done in this area? Are there any resources for people who are HIV positive, who think that they're HIV positive? Do they have access to medicine, to screenings? So working alongside with local government and healthcare workers to go and to identify just that. So looking at action, the fifth phase of the pre-seed, proceed model is implementation. So what are we going to go and do once we've gathered all this information? We want to go and provide information first and foremost, provide auditory, written, visual resources for these young women regarding HIV. Now, these resources can be videos, it can be CDs or recordings, pamphlets, trying to go and just provide them with adequate and up-to-date information. Additionally, it would be great if we were able to go and provide testing for all these women. We understand that, I understand that there are taboos associated with being HIV positive. And I lived in Kenya for quite a while. Worked with AIDS orphans, and there were a lot of people who did not want to get tested for HIV because if it was positive, they were afraid that the results would be told to other people. So we need to go and ensure confidentiality for these patients. Additionally, we do this HIV testing, let's say, to come out positive. Well, there was this test that was conducted, this research study that was conducted in 2010 by Colligan, and basically it looked at the fact that we have an overwhelming amount of HIV positive individuals throughout Africa and throughout the world, and there aren't enough doctors for it. So this testing, this study looked at the idea of going and switching the focus from being a physician-based practices and clinics to being more nurse-oriented or even non-medical staff going and running these clinics. So it was an interesting study. It was a pretty good read, and I think that it's a very good answer to the shortage of access to healthcare for some of these individuals. Now, another thing we'd like to do is create a support group for HIV positive individuals. So let's say we do the testing and it turns out that these HIV positive individuals, they find out that they're HIV positive. Or maybe they have a loved one or that someone has died from HIV or from AIDS. Creating a support group unbiased place where people can get love and compassion and support and resources is really important. And once again, the goal would be that 85% of those who are HIV positive would participate in this. Additionally, the plan is to hold discussion forums as well as informational conferences for these young women, thinking that these women can anonymously go and write down on a piece of paper, drop it into a box, different questions that maybe they're too embarrassed or too shy to go and to ask. Lastly, providing an open door policy for women who may believe that they are HIV positive, or maybe they just have more questions about it, a place where they can talk and they can learn in a private and a safe environment. There was a study conducted in 2010, and it talked about a lot about the idea of disclosing information for people who are HIV positive, one to them and then also to others, and just talking about being strategic in the ways in which we go and let these patients know that they're HIV positive, to be compassionate and caring. So going and providing an open door policy would be ideal for this situation. Afterwards, we'd like to kind of evaluate this work. And three different things we need to evaluate is one, the process. Did our process work? Is there anything that we need to change? And in order to go and do this, we look at the predetermined goals and objectives that we had identified previously. If they weren't met, well, why weren't they met? What can we go back and what can we do differently? The impact evaluation is, is what we taught, was it soaked up? Did people learn what we taught? And for going and doing this, thinking that using questionnaires, possibly even going and doing like an end of the conference test, sort of, very simple one, just to go in to make sure that these women, that they understand and that they took in and they're able to teach back to us what they learned. Additionally, looking at did we get 85% participation in the screenings and support groups? Outcome evaluation is, were we successful? Did people learn about HIV? Did anyone find out they were HIV positive and maybe they didn't know? And in order to go and look at this evaluation, we would be looking at the results from the HIV testings, as well as reading through the evaluations and the questionnaires from the different participants. So in conclusion, we really need to understand that every population, every group of people is different. And in order to go and to be successful in planning and managing some illnesses or community work that we're going to go and do, we need to go and find out where our population, where the patient or where the demographic group, what they believe, what they understand, their best way of learning. We need to go and cater our teaching plans, our interventions specifically for our patients or for the group of people that we're working with. In the case of HIV positive young women or HIV and young women, understand that in order to go and be successful in any community-based teaching like this, that it's very important for us to have very thorough assessment and understanding. These are the references. Oh, that's weird. Sorry, that one is really big. That's weird. Okay, well, thank you guys for your time.